So my talk is next. I'm going to talk about exosomes in aesthetic medicine, and I'm wondering if these procedures will replace lasers. I would really want to have a kind thank you to Exco and Benev for sponsoring our webinar today. So I've been, like Steve and Tunch, a disciple of regenerative medicine and nanofat for clear reasons for some years. This 1 year result also, though, required some surgery, harvest, and time to truly see a real outcome. And in our aesthetic practices, what has value today, especially in the hopefully post-COVID era? I think patients want similar results, and they'll accept slightly less than surgical results, but they don't want surgery, they don't want downtime, and they certainly don't want to wait for a good outcome. I think their values have changed because many of us are on Zoom calls, as we are today, and work from a home office. So what might not have bothered them about their appearance in the past is suddenly cast into a sharp focus when they see themselves on the camera. It's interesting that nanoparticulate medicine began in 1849 with a concept by Darwin. And his thoughts were that small particles called gemmules were shed from each organ in the body and were coalesced into the reproductive system so that these traits and characteristics could be passed on to your progeny. This illustration is from a book that both Tunch and Steve Cohen are editors on, the QMP facial regenerative surgery, and I believe that's coming out soon. So what are exosomes? Tunch has gone over this, but these are derived from intracellular endosomes. And endosomes used to be thought of as the garbage can, which collected all of the cellular debris. Endosomes will fuse with the cell wall, and the exosomes, or the small particles that are expelled, are now extracellular. They are tiny, smaller than the diameter of a human hair. They do contain mRNA, miRNA, siRNA, as Tunch pointed out, as well as over 1,000 peptides and over 300 lipids. And they can be derived from any cell type that generates secretions. So the history of exosomes, technically, they were discovered in 1983. But I feel the real understanding of the mechanism of action happened in the mid-2000s when the Italian Gnecchi and colleagues had the cardiac experience. They tried engrafting some cardiac-derived stem cells and found very little success when counting the number of engrafted cells, but the effects, clinical effects, were excellent. They came up with a theory of exosomes stimulating paracrine cell signaling. This is a really rapidly expanding field in every aspect of medicine, and currently there are about 20,000 PubMed indexed articles at least every year. So what is paracrine signaling? We know autocrine signaling, where the cell signals to itself, and endocrine, where the signal is seen very far away, such as the effects of hormones such as thyroid hormone and your testosterone and estrogen hormones. But paracrine signaling is somewhere in between. It involves a messenger peptide that seeks out, targets, and fits to a ligand on the receptor cell. There are many paracrine pathways, and some of them are very complex and poorly understood. But usually, this is not what was originally thought a direct cell-to-cell signal, but it is more regional. Exosomes are released into the ECF, and these can target destinations through the aid of homing proteins. And this is, I think, a pretty important concept. It's just not direct regional access. So Exco Bio and Benev have a product called Exosome Regenerative Complex. And this is something that combines lyophilized exosomes with a diluent, which contains HA and some growth factors. Exco Bio is one of the 4th most important and best funded international exosome companies. Many of these companies are really focused more on research, such as Kodiak, and few have any aesthetic and available products. How are exosomes produced? And I think this is important to know. because when selecting your source of exosomes for use in your clinic, you really need to have a little bit of a good background on them. There are many, many exosome sources out there, and some are definitely better than others. So you'd want to select sources which are pure. There are companies in the US that have amniotic stem cells, placental stem cells, adipose-derived stem cells, and MSCs or mesenchymal stem cells. We don't really know, as Steve pointed out, what the magic ingredient or the magic cell is, but we do know that younger cells are a little better than older cells. The cells are cultured in conditioned media, which is basically the cell culture food. And the control media is the part that contains the exosomes. The conditioned media undergoes decantation, and after which it is ultrafiltered or ultracentrifuged. And then the exosomes are either frozen or lyophilized. So here's an outline of different production methods, and this is the TFF or tangential filtration basis. After your conditioned media, which contains debris, waste, and sometimes fetal bovine serum, is filtered. The first filtration it undergoes takes out the larger particles, then the second filtration takes out smaller particulate matter. TFF, I feel, is superior to ultracentrifugation for many reasons. The best aspect of this is purification because there's much more efficient removal of contaminants. You also get a lot better recovery. And as Steve pointed out with the nanocube, you really want to get recovery of all of the important aspects and get rid of the aspects that don't really mean anything. And as well with TFF, you get better consistency. Conditioned media itself would be analogous to putting the serum on somebody's skin, which you would use after in the process of PRP. So because it's not very concentrated, you're not going to have a lot of clinical effects. But even enriched conditioned media is not as good as purified exosomes. It's important to know that lyophilization can preserve your exosome membrane or the bilipid layer. And the structural importance is that if you have lyophilized exosomes and you keep them in the refrigerator, not an 80-degree below freezer, then you can have a shelf life of 24 months. And the frozen exosomes, of course, degrade quite a bit before then. So how are donors selected? They're usually volunteers 18 to 25 for adult-derived stem cells, which is the exicobio product. These are adipose-derived, and the patients are tested for multiple conditions before donating. And if the donors fail any one of these tests, obviously their cells are not used. The guidelines for eligibility determination for donors of cell therapy products is the paradigm that they follow. Diagnostic uses for exosomes, and Tunj touched on this. It's really interesting because you can now do a liquid biopsy. You don't need tissue from the actual organ or structure itself. You can do urinalysis to find out if somebody has prostate cancer. Breast cancer diagnosis can be used from an aspiration of fluid from the breast. Exosome markers are seen for Alzheimer's and Parkinson's disease. And also this can be used in diagnosing diabetes, lung problems, renal disease, and cardiac disease. Some therapeutic uses for exosomes outside aesthetic include the ability of exosomes to cure some types of cancer, say dendritic cell cancer, through a T cell manipulation. They can restore some function to damaged cardiac muscle. And a big use in the US is treatment of ARDS and long haul patients for COVID, post-COVID treatment. Liver and kidney disease are also targets of current therapeutic uses of exosomes, as well as is breast cancer. The aesthetic applications include active acne, alopecia, acne scarring, dark under eye circles, large pores, and I use them also for acute burns and post-laser care. The exosome product for skin rejuvenation that is Benev created uses an exosome regenerative complex. There is a container of lyophilized exosomes, I usually will dilute this with 2 cc's of sterile injectable saline just to get all the exosomes off the edge of the glass, and then inject this mixture into the diluent, which contains about 5 cc's of HA, growth factors, and other active ingredients. Because of the FDA ruling, we recommend that this only be used topically. This was my first patient that I treated with topical exosomes. She's a 58-year-old patient who had recently undergone a radiation cancer treatment for stage 4 lobular cancer. Her burn was so severe that it went all the way through the front of the chest wall, behind her scapula to the skin of the back. She was not responding to sulfur sulfadiazine. The middle layer of pictures is her photo 5 days after topical application, and the bottom set of photos is 9 days post-treatment. She thought this was magical and noted that the pain of the burn immediately went away with the first application of exosomes. So Exicobio and Benev have contributed quite a bit of literature to the exosome compendium, and many of these, of course, are production or quality control issues, but there are also some publications on atopic dermatitis and skin regeneration, as well as acne scarring and skin brightening. There was another patient of mine that I treated with microneedling, non-thermal, followed by the topical application of exosomes. This patient was 3 days away from being married and wanted to look great in her wedding photos. You can see a remarkable improvement in about 24 hours after the use of this combination. How do you choose the right patient? I select patients ages 20 to 60s, and in the younger patients, we generally tend to target active acne, acne scarring, rosacea, melasma, and dark under eye circles. It has an amazing effect on large pores. In the older patients, we target these as well as some fine lines and crepey dry skin, as well as mild laxity. This patient has a really interesting story. She called me on a Thursday night to cancel her procedure for the next day. I was astounded because she had already prepaid a not inconsiderable sum for fat grafting with nanofat and laser resurfacing. She told me she had a new boyfriend and she had a Zoom meeting on Monday that she couldn't miss, so she couldn't afford any recovery time. So she's the one who made me come up with a treatment. And for this particular treatment, I used a chemobioresurfacing approach using intradermal botulinum toxin and HA injections, some under eye filler, and microneedling with topical exosomes. Her result on the right was 3 days later. She was really happy with her outcome and said she wanted to continue these on a regular basis. As Tunch noted, the FDA notification in December of 2019 pointed out that due to some unwanted effects of exosome treatments on some patients in Nebraska, the FDA would be enforcing their position on regenerative medicine, and this has been reiterated lately. They made it clear that there's no indication for exosomes at the current time. However, I think my experience with exosomes has been similar to others with PRP. I don't get these kind of results with PRP, but I would be very hesitant to stop using this topical treatment. We should note that topical treatments are not currently regulated by the FDA, who is limited to anything that might pass through the stratum corneum. So what about downtime with chemobioresurfacing? And this is something that I'm currently investigating, a combination of intradermal botulinum toxin and HA, which is off-label, as well as microneedling and topical application of exosomes. Here's another patient who is very difficult to treat with anything because of her skin type 6. She complained of large pores, uneven pigment, and some old acne scarring, as well as a scratch on her left cheek. She was treated with botulinum toxin and HA intradermally. And then we did some topical microneedling at 0.5 millimeters, 3 passes, and applied a topical exosome balm. You can see the picture on the far right was 5 minutes after her treatment. And 3 days later, I feel like she had a pretty amazing result with decrease in sebum production. Her pores are quite a bit smaller, and the scratch on her left cheek is totally healed. Here's the formula for chemobioresurfacing. If you're interested, please do take a photo of it. Obviously, I go through the preliminary photos, consents, etc. I mix 20 to 30 units of botulinum toxin diluted 100 units to 2.5 cc's of normal saline for injection, plus a cc of HA diluted with 4 cc's of normal saline. This will give you slightly over 5 cc's of injectable. And this goes in, I use a multi-injector, and you can also do this manually with mesotherapy. The multi-injector dose is 25 microliters per cc at a 0.8 millimeter depth. I apply topical exosome balm derived from the Benev product, which includes 30 cc's of aquaphor, 1 cc of squalane, a cc of essential lipids, and the ERC. You can also add tranexamic acid if the patient needs a little bit more help with pigment or topical vitamin C. Here's a patient that I treated with chemobioresurfacing and 1 cc of under eye filler. 3 days post-treatment, you can see that she has a really impressive improvement in skin quality. Tunch was interested in exosomes for hair. I used a different product for this particular patient, and because I wanted to inject it intradermal, and the Benev company is a strict FDA rule follower. But you can see, I think, a pretty amazing regeneration of hair 1 month following injection of 5 cc's of MSC-derived extracellular vesicles. And it's interesting because this is a patient who's considering a hair transplant, but no longer needs one. Here's his occipital view at 1 month. And I've never seen regrowth this quickly from any of the PRP patients that I've injected. I like to measure things. And so I use the Canfield Hair Metrics system, as well as 2 small tattoos to re-identify the exact area where I injected these exosomes. And the measured increase was 19 new follicular units per centimeter squared. How do we measure outcomes in skin roughness? This is a Primos unit, which takes an index of topographic variation as well as a linear waveform measurement. Here's another patient who is 38 years old, 3 days post injection of chemobioresurfacing elements, followed by topical microneedling and exosomes. The use of the Primos will give you a topographic measurement. We see 23.8% measured improvement in skin roughness here for acne scarring. What is the future of exosomes? I think that we're going to have designer exosomes, as Tunch mentioned, that are going to be targeted to be tissue specific and effect specific. For example, co-culturing from dermal fibroblasts with hair follicle or stem cells from the hair follicles and or adipose matrix will change the genetic markers in a different way. Paracrine signaling can be enhanced with ligand specificity and homing proteins, and by engineering the proteomics of exosomes, we can really enhance certain effects. So in conclusion, I feel like exosomes are well accepted by patients. They like it better than PRP because there's no blood drawing or processing. You can use it topically following microneedling. I think the hair treatment is quite effective, and FDA approval won't be for aesthetics, but when it is approved, it will be more for ARDS and use might be off-label. Thank you very much.